West Bengal to Delhi, let's tell you about pollution and the politics that has erupted over worsening air quality in Delhi city. Delhi's morning continues to wake up to grey skies in November and the air quality remains very poor. Air quality in the NCR region continues to remain in the poor, very poor category with an average AQI of 300 plus recorded at 7 this morning. The AQI at Ames was reported in severe category. In areas like Akshardham, Anand Vihar, ITU, it was in a very poor category. Leader of opposition in Lok Sabha, Rahul Gandhi, has lashed out at the BJP-led centre and Delhi government, again led by the BJP, over the thick blanket of smog and demanded clean air. Gandhi posted his old video on X where he is seen speaking to an environmentalist about Delhi's pollution crisis, claimed that Delhi's air is becoming more and more toxic every passing year. The leader of the opposition has said that the BJP is making new excuses in spite of the double-engine Sarkar. Responding to Rahul Gandhi, Delhi CM said AAP and Congress didn't provide any solution for the pollution problem and have no right to question the BJP government.
पॉल्यूशन जो आज की डेट में है, पिछले साल जब पिछली सरकारों का राज था उससे नित रोज कम है। और जो लोग 15 साल की सरकारें चला के चले गए, कभी उन्होंने दिल्ली की चिंता नहीं की, कभी दिल्ली को समाधान नहीं दिया। जिन्होंने 11 साल की सरकार चलाई, कभी उन्होंने समाधान नहीं दिया। आज वो हमारी 8 महीने की सरकार से प्रश्न पूछ रहे हैं। हमारे कार्यकाल में हमने जिस तरीके से लगातार प्रयास करते हुए दिल्ली के पॉल्यूशन पे काम किया है और क्लाउड सीडिंग भी उसमें हमारा एक एफर्ट है। एफर्ट करना किसी भी सरकार का कर्तव्य है और कोई भी काम हम पॉल्यूशन दिल्ली का कम हो इसके लिए छोड़ने वाले नहीं है। हर प्रयास करेंगे, हर ताकत लगाएंगे, हर जनता को सुविधा देने के लिए हर संभव कार्य करेंगे।
राहुल गांधी जी आज वीडियो डालकर पूछ रहे हैं कि दिल्ली का AQI ऐसे कैसे खराब हुआ। राहुल गांधी जी, ये किसी और ने खराब नहीं किया। 15 साल तक कांग्रेस की सरकार ने ये शुरुआत करी और 10 साल बाद में अरविंद केजरीवाल जो आपका सहयोगी है और चुनाव मिलकर लड़ते हो जिसके साथ, 10 साल तक उन्होंने बर्बाद की। मैं बताना चाहता हूं, पिछले एक दशक, पिछले 10 साल के सबसे साफ दिन रेखा गुप्ता जी की सरकार ने इस साल दिए हैं। मैं आपको यह भी बताना चाहता हूं कि सबसे गंदे दिन अब तक के यह भी आपके 25 साल की सरकार में रहे हैं। कम सबसे गंदे दिन अगर रहे हैं तो वो भी रेखा गुप्ता जी की सरकार।
All right, I'm going to bring in my colleague Piyush for more details in that story. Piyush, do continue to be with us as you tell us about the worsening air and the worsening politics in Delhi as well over this matter. Dr. G.C. Khilnani, Chairperson, PSRI Institute of Pulmonary, Critical Care and Sleep Medicine, is now also joining us. Dr. Khilnani, to you first. In 40 years plus of your practicing medicine, you've been a pulmonologist all your life. Have you seen anything as bad, as toxic as what you're seeing right now?
So, Sneha, it's not anything different from last 30-35 years. If at all, it is a shade better as far as the AQI is concerned. But I'll give you a health aspects of it, how it is affecting us.
Yes.
There are two types of patients that I am seeing. I am a pulmonologist, so I'll restrict myself to that.
Okay.
The healthy people are getting, sore throat, cough, difficult chest tightness, difficulty in breathing, who are not asthmatic, who don't have bronchitis, who don't smoke. There's a dryness of throat, they don't sleep well, the appetite goes down, general well-being is not there.
Okay.
And if you tell somebody your symptoms, you don't get any sympathy because they say, oh, this is normal, it happens everywhere. But those people who have chronic asthma or bronchitis, or they have heart disease, or they have COPD, those who are on oxygen, these are the people who actually are suffering.
Right.
And I would say that my hospital admissions and ICU admission have increased by at least twofold during last 10 days.
Okay.
And it's nothing new. It happens every year. The oxygen requirement goes down. Patients who are on inhalers, they go to nebulization. Those who are on nebulization go to oxygen. And what is important is that those people who keep coughing, they do not respond to their usual medication. They do not respond to antibiotics. They do not respond to inhalers. Quite often, we have to resort to corticosteroids because basically it is a inflammation caused by air pollutants which affects our lungs.
You know,
So
Dr. Khilnani, I want to ask you, if a woman is pregnant or if a person is very ill, the immunity is down, the immunity is suppressed, should that person even consider leaving Delhi city today?
no, I think I have been misquoted on
Okay.
various media channels when I said there is a section of people who are on oxygen,
Yes.
who have chronic respiratory failure. Very minuscule of them have their alternative home somewhere in India or abroad or wherever. Very, I would say 0.0000 you can say. Those people, when they ask me, sir, shall we leave Delhi for a few days? I said, yes, your choice. You can do that. But it's not an advisory for patients to leave Delhi. That's not a solution.
Okay.
If there are some solutions which I would like to put forth. That is one, that restrict your movement outside during smog.
Okay.
Do not go for morning walks in the morning when there is a smog. Avoid going to crowded markets. Use N95 mask when you go out or travel by air. And also use air purifiers judiciously, and there are parameters that you should follow.
You know, I want to ask you, I've been using the N95 mask for days together, but I have not seen one person do it, Dr. Khilnani, on the streets of Delhi NCR region. Isn't that problematic that we've normalized this filthy air that we breathe?
Yeah, that's right.
Yes.
When you use N95 mask, only thing you are using it because you realize the gravity of situation. You have, so the awareness is very important. So we need to be aware as to what is the benefit of this mask. Then only you will be able to tolerate. There are studies which have shown during COVID time that using mask you may feel claustrophobic, but the oxygen doesn't go down. And once you accept the fact that you have to use a mask, after a few minutes, because during COVID time, didn't healthcare workers use masks for 24 hours a day without any problem?
We all
But
did. Yes.
initially you do feel claustrophobic, थोड़ी घुटन होती है उसके साथ. If you bear it for a few minutes, then you will be able to do it, and we do it all the time doing procedures.
Yes, Dr. Khilnani, N95 or N99 or either or? What are you suggesting essentially?
So
What's your advice?
the best mask is KN99. That is the
Okay.
best mask for air pollution. I also want to tell you through you that if you are using a cloth mask or a surgical mask, as we advised during COVID time, it has no value in protecting you from the air
Yeah.
pollution because the particles are really small. And why WHO does not agree that the mask or air purifier helps, because we have no idea on day-to-day basis as to what is the state of the nanoparticles.
Okay, okay,
They actually are not stopped by these masks. So
okay.
there is no 100% benefit of neither air purifiers nor any kind of mask. But yes, the kind of air we are breathing at this point of time, I would strongly recommend both the things, especially for the people who are vulnerable. About the pregnant woman, it is actually very important where you started, that it affects not only the woman, it affects the fetus, and the high incidence of what you call as intrauterine growth retardation. Therefore, the situation is pretty serious. But again, at the cost of repetition, I would say there's no case for leaving the city and going to another place for this reason. If you take proper precaution and vaccinate yourself, especially elderly, for pneumonia and flu, you will largely be able to protect yourself and lead a normal life.
Okay, okay. Dr. Khilnani, I'm going to thank you for joining in and sharing your
Thank,
views with
thank
us.
you. It
Very
is a pleasure.
important that you say these things, and viewers, N99 mask is what Dr. Khilnani has said is extremely important. You must invest in a good mask. Remember, a cloth or a surgical mask is not going to help you at all because these masks, essentially the cloth mask, will not be blocking those particles. Very tiny nanoparticles is what Dr. Khilnani has said. Piyush is also with us. Piyush, in fact, the Delhi Chief Minister, in conversation with India Today, has just indicated that the Congress government of 10 years ago and the AAP government has done nothing. But this is the government that came, or this is the party that came to power with promises to clean up Delhi's air and do much more than what their predecessors had not done. What about those promises?
Well, Sneha, the governments have changed, but nothing has changed for the people of Delhi. Every year we see the same story, same situation. And as we are reporting, the air quality index has crossed the mark of a very poor category. I'm right now reporting from ITO area of Delhi, and here the air quality index has been reported to 348. But if we talk about overall quality, it has now crossed the mark of very poor. In areas like Wazirabad, Jahangirpuri, the air quality index has crossed 401 mark, and in areas which are in central Delhi, it is near about 348 to 350. So all in all, the air quality is very poor in national capital. We are seeing how war of words are taking place between political parties, where Rekha Gupta is blaming Congress and Aam Aadmi Party. On the other side, Aam Aadmi Party, Congress is blaming BJP government. But at the end of the day, it's the people of Delhi who are at the receiving end, and every time, every year at the same time, we hear the same story and we hear similar sort of war words, but no government has been able to successfully control the situation, and it is certainly costing a lot of things to the people of Delhi, because the air quality day by day is now getting deteriorated.
Absolutely. Air quality is just only, in fact, worsening as far as Delhi NCR region is concerned. Piyush, I'm going to leave it at that for the moment.